The news day continues here on One News Now. I'm Charles Lejano. The Health Department is now working closely with both the DILG and the DOJ to come up with possible penalties against persons who jump the vaccine priority line. To give us more updates on the COVID-19 response in the country, Greg Gregorio is joining us live from Mandaluyong. Greg, what was the DOH's reaction on this issue?
Charles, according to the Department of Health, they are now eyeing for ways to hold accountable those personalities who were reported to be jumping the line of prioritization for the government's vaccination program against COVID-19. Health Undersecretary Maria Rosario Vergere emphasized that a prioritization framework is in place with the objective to give the vaccines to those individuals who are most at risk with this infection. Recall that under the prioritization list of the government, first to be inoculated are the healthcare workers, followed by senior citizens, persons with comorbidities, and other frontline workers. And Vergere also reiterated that the World Health Organization has warned the Philippines that if there are breaches against the agreement with them through the COVAX facility for vaccine supplies, our future or additional supplies of vaccines may be compromised. Charles?
Right, so much for vaccines for now, at least, Greg. But then, do we have any new data regarding the various COVID-19 variants present in the country?
Charles, aside from the earlier reported that the cases of SARS-CoV-2 variants are already here in all of the 17 cities and municipalities of the National Capital Region, the Department of Health is now saying that cases of SARS-CoV-2 variants are also in other regions. For the B117 or the UK variant, there are 7 regions including the National Capital Region. This includes the Regions 1, 3, CAR, Calabarzon, Region 6, and Region 10. And for the B1351 variant, or the variant first detected in South Africa, there are already 6 regions with these variant cases, including the NCR. And these are Region 2, Region 3, Calabarzon, Region 10, and Region 12. Now, as to the P.3 variant, according to the Department of Health, it will be the World Health Organization to determine if this P.3 variant first detected here in the Philippines is also or is already a variant of concern. Now, the Department of Health is also saying that they are in continuous coordination with the World Health Organization to determine as to whether there is already a community transmission of this SARS-CoV-2 variant of concern here in the Philippines. Charles?
Thanks for that, Greg. One other thing that we're closely watching would be the hospital care utilization and the ICU bed capacity all over the Philippines. How are we doing here?
Charles, as of the latest report of Treatment SAR Health Undersecretary Leopoldo Vega, we now have the 60% hospital care utilization rate across the country, while it's one component, the occupancy of ICU, is already at 76%. According to Health Undersecretary Vergere, while the hospital care utilization rate in the Philippines has not reached the high risk yet, they are now addressing this with certain measures. First is to decongest the hospitals, since they have found out that 50% of patients in hospitals are mild and asymptomatic, so they have to be transferred to temporary treatment and monitoring facilities. Other strategy is to assist hospitals into expanding or allotting or giving more allocation for COVID-19 beds and building more temporary facilities for mild and asymptomatic cases. Charles?
All right, so those are the plans in place. But then one other thing that's worth mentioning would, of course, be the NCR Plus bubble that has been implemented to try to address our case count. How long before we can see this particular policy taking effect?
Charles, according to the Department of Health, it might take 2 to 3 weeks before we can see the impact of the implementation of the NCR Plus bubble to the trends of COVID-19 cases in the Philippines. Charles?
All right, then what then would be the government's plan to address the need for more health workers and treatment facilities given that we are still what appears to be on an upward trend?
Charles, the DOH said similar to the challenging situation last year when the COVID-19 cases in the country peaked at some point in August 2020. Vergeres said that they may consider asking help from healthcare workers in areas with lesser number of COVID-19 cases and lesser hospital occupancy, and provide assistance to hospitals in areas with higher COVID-19 cases. And Vergeres also said that the hiring of healthcare workers is continuous since last year. Charles?
Thanks for that report, Greg. That was Greg Gregorio reporting live from Mandaluyong. Amid rising cases in the country, Pampanga beefs up restrictions via a house lockdown. What does this entail? JC Cosico will tell us.
At the boundary of Columpit, Bulacan and Napalit, Pampanga, policemen halt motorists for inspection. Only residents and essential workers will be allowed entry. This collector from Malolo City was asked to return after failing to show some documents.
May ano po ba kayo dun sa pinagtatrabahuan nyo? May papel kayo?
May papel, hindi ko pa nadala.
Pero kuha muna kayo ng certificate nyo.
Roji from San Fernando City has to content himself with observing Holy Week online instead of joining relatives in Mexico, Pampanga.
Gusto kong magbakasyon dito dahil wala nang pasok. Kaya lang, wala, hindi pwede. Bawal.
Pampanga has heightened its restrictions following a surge of cases nationwide. Its Public Information Office has reported nearly 9,000 cases, about 1,000 of which are active. They have no cases yet of foreign variants. Barangay San Agustin in San Fernando has over 30 active cases, one of the highest in the city. From an average daily caseload of 25, Pampanga has now reached 120 since last Thursday.
Yung mga tao masyado na naging relax pa. Yung mga family gathering nagsimula na naman, kaya kung titignan mo yung mga tinatamaan ng pamilya-pamilya eh.
Governor Dennis Pineda implemented a household lockdown from March 20 to April 5. This prohibits households from accepting guests. Non-residents may still enter the province as long as they present negative swab results taken within 72 hours. Only 2 adult residents may be allowed to leave.
Discourage namin talaga yung mga gatherings muna within residence na salo-salo, birthday o ano, huwag muna.
Barangay officials will monitor the situation on the ground.
Wala ka pa 18, di ba? O, 17. Bawal yan.
There will be curfew hours from 10 p.m. to 5 a.m. A liquor ban will also be in place. For News 5, JC Cosico, we are One News.
Some health experts say it's impossible to substantially bring down the reproduction number of the coronavirus within 2 weeks of the NCR Plus bubble. To help us understand this issue, we are bringing back on the line OCTA Research team member, Professor Guido David. Good afternoon, Professor. Let's start with the reproduction number. Yes, thank you for joining us, Professor. Let's start with the reproduction number of COVID-19 right now at 2.1. Should alarm bells be ringing at this point?
Well, yesterday the case number decreased actually, so the reproduction number decreased a little bit. It's around 1.99 right now. Yeah, we are alarmed, but we are hopeful that the interventions introduced by the government within the next 2 weeks will help bring down the reproduction number.
Right, but then in another interview, we have Professor Ranjit Rai mentioning that this NCR Plus bubble will not help in lowering that number within 2 weeks. What's your take on this?
Actually, it was probably misquoted or something. Our position is that it will help reduce the reproduction number, but it will not reverse the trend, or it is not likely to reverse the trend after 2 weeks. So that's what we are saying. What we're saying is that it will be difficult to get to a downward trend in NCR plus after 2 weeks. We're not saying it's impossible, but we're just saying it's not likely based on history, because last year in July to August, when we went to MECQ, it took us 4 weeks to bring down the reproduction number from 1.7 to less than 1. So right now we're thinking that, based on history, it would take at least 4 weeks to reduce the reproduction number from 2 to less than 1. It may take longer, but we're not saying it's impossible to do it in 2 weeks, but it's just not very likely.
All right, thanks for clarifying that, Professor. We will probably just need more time, longer than 2 weeks. But then, should the government implement another ECQ in your mind to curb the surge in cases? And based on what we've seen so far, is this looking likely? Or what other measures should the government now implement in lieu of a full lockdown?
Well, the government just implemented these measures, so I think we should give these interventions a chance, and we would like to see the effects of these interventions first before we make further restrictions or additional interventions. So we hope that we will see the effects of these interventions within this week, by next week, or within the next 2 weeks, and we can decide then if we will need to, further slow down the reproduction number, the trend, or if we're already headed there, then we probably don't need to add more restrictions.
All right, Professor, we were talking about the hospitals in Metro Manila slowly getting overwhelmed, although not quite there yet. What possible steps can be taken to prevent hospitals in the Metro from being overwhelmed?
Well, I believe the Department of Health has a one-command system. They're looking to add additional beds. We can also perhaps try to convert some hospital beds or ICUs from non-COVID to COVID beds. This is just a suggestion. Of course, the hospitals will be the ones who will make the final decision there, if that is feasible. Because right now, hospital beds and ICUs for COVID are already at or close to 70%. But there is more headroom for non-COVID ICUs, and that's why we think that this could be a possible move if cases continue to escalate.
Right, so I suppose for now we just have to wait and see. And then one other thing, Professor, that hit made the headlines today was this little tiff between authorities of the Catholic Church and, of course, the authorities of the government. Do you agree with the government's order to suspend all physical religious activities in the Metro? And if so, what's the science behind this?
Well, what the government is trying to do is to reduce mobility and to, reduce interaction of people in public areas. Though I understand when I read the proposition of the churches, they just wanted 10% capacity in churches, which may not be significant anyway. And I never want to bet against the church because, we had a holiday, we had Simbang Gabi, we had Translation, and we did not have a surge during those periods. So, technically speaking, the government has a position that, it wants to reduce, mobility and, increase social distancing, reduce social interaction. But again, on the other hand, again, based on history, we did not have surges. So, of course, this is a decision between the government and the churches, but I think they should at least have a conversation about it.
All right, thank you for your time and for your usual insight, Professor. That was Professor Guido David of the OCTA research team on the line. Here are other stories we're watching from around the world. Pot banging protests erupted across Brazil. as the country suffered a record 3,251 COVID deaths on Tuesday. Despite this, Brazilian President Jair Bolsonaro claims that his government has never failed to adopt measures to fight the pandemic. Bolsonaro also swore to ramp up vaccinations this year, as only less than 3% of Brazilian adults have so far received complete vaccine doses in the country. The Kremlin has announced that Russian President Vladimir Putin has received his first dose of COVID-19 vaccine. However, the Russian government did not release photos of the vaccination or disclose what vaccine brand Putin used. What they did say was that all 3 vaccine brands from Russia are reliable and effective. Landmarks across the United Kingdom lit up on the anniversary of the COVID-19 lockdown as a beacon of hope and support for those who have lost loved ones to COVID-19. More than 126,000 people in Britain have died due to the disease, the highest death toll in Europe and the 5th highest in the world. Official data shows that some 1,000 people have already died in the UK as of March 23 last year, when Prime Minister Boris Johnson first ordered the lockdown. And those are the top stories of the hour. Join Riza Diaz later at 2:15 p.m. as we continue to monitor the day's biggest stories. You can also catch One News on Signal Play. Just register for a free account at www.signalplay.com so you can stream One News live anytime and anywhere. I'm Charles Lejano. Mask on, wash hands, and stay safe, Philippines. We are One News.